Honorary and Clinical Pharmacist, USA, and Dr. Anantanayak Nagappa, Director, Amity Institute of Pharmacy, to talk about pharmaceutical care. And we are very fortunate to have both of them to be with us today. We, on behalf of College of Pharmaceutical Sciences, Dayananda Sagar University, wholeheartedly welcomes you all to this webinar. Now, I request Dr. Sai Vaishnavi, Assistant Professor, Department of Pharmacy Practice, to introduce our first speaker of the session, Dr. Mahadev Bhatt. Over to you, Vaishnavi.
Excuse me, I think Dr. Nagappa is going to go first, okay?
Oh, okay, sir, okay.
Oh, okay.
Vaishnavi ma'am, can we have 1 minute? We have our beloved principal, Dr. N.M. Raghavendra sir, joined with us. Sir.
Good morning, sir. Good morning, sir. Dr. Anantanayak Nagappa sir. How are you, sir?
I am fine. Thank you very much.
Sir, Mahadev sir. Good morning. How are you, sir?
Good morning. I am fine. Thank you so much. Thank you for inviting.
Yeah. Apologies for arranging this webinar on a later day because we had semester exams and students were all busy with their exams. And fortunately, we got this today where all our family students are joining and your guidance and motivation.
Sir, B.Pharm students also are required.
Yes, sir. Yes, sir. Yeah, they're also there. So your guidance and motivation is very much required to establish pharmaceutical care services across India. Thank you very much for extending your support and encouragement for our College of Pharmaceutical Sciences. Thank you, sir. Thank you.
Vaishnavi ma'am, can we just have the introduction to the speaker, Dr. Anantanayak Nagappa?
It's audible. Sir, it's audible?
Yeah,
Yes,
you're audible, madam. But video is off.
Am I audible? Yes. Hello.
Yeah, video.
Sorry for the inconvenience.
Vaishnavi ma'am, you're not audible, ma'am.
No.
Yes, ma'am. You're audible. You can go ahead now.
Ananta Nagappa sir and Mahadev sir, today we have a Swachh Bharat campaign organized in our campus. So we are cleaning the streets near around our campus. It starts from main gate of campus and it goes up to ISRO layout. So I'll be taking a leave after some time. Please excuse me for that.
Okay. No problem. No problem.
No issues.
Dr. Anju.
Hello, sir.
Yeah, please continue. No, please continue.
Sir, I guess some troubleshoot problem, sir. Sorry for the inconvenience caused.
No.
Yeah. I request Dr. Sai Vaishnavi to introduce the speaker, Dr. Anandanayagappa. Good morning, everyone. Thank you for the opportunity. Dr. Anant Naik Nagappa has been an educationist for more than 3 decades. He is the founder, president of Association of Community Pharmacists of India. He intends to create awareness regarding safe and quality use of medicine among fellow human beings. He has more than 150 national and international publications and has authored for various books. He is working as director, MIT Institute of Pharmacy, MIT University, Gwalior. His mission is to learn, practice, and teach high quality pharmacy related knowledge and to strive hard to pursue scientific research related to pharmaceutical care. Thank you, everyone. I welcome Mr. Nagappa, sir, to the webinar. Thank you so much. Please on the video. Sir, now the session is yours. Can we have your talk, sir?
Yeah, sorry.
Yeah.
Good morning, Dayanand Sagar.
Very good
friends,
morning to you, sir.
Very good morning, sir. Very good morning.
Friends, I wanted to say a good thing to you that a new phase, a new turn in our profession is taking place. We have given 200 seminars, similar seminars, and 120 active centers have been opened, the WhatsApp group. Now, what are we going to do with that WhatsApp group? We are telling as per the pharmacy practice regulations, which is down the line of this thing, it clearly mentions the role of pharmacists in the healthcare, and which we are not doing it. People who have gone abroad, they know what the value the pharmacist get and what for he gets value. He is deeply involved in the community prescription analysis, which has to be taken up, and which we are not doing it. So we are very indisciplined in this aspect. We have a diploma fellow who is oriented in more sales of the product rather than patient welfare. Because de facto it happens because we don't pay for the services of the pharmacist. We don't pay for it. But in other countries, the main difference is they are paid well. They are paid very well, so that everybody who goes abroad after a pharmacy degree wants to become a community pharmacist. So we are thinking why we can't become like that, and at what cost we are doing it. So what is happening? Suppose my mom or my granddaughter, anybody falls ill, they will be asked to they will be prescribed with the medicines. And you all know, I all know that these medicines are not safe, and they should be used under a supervision of a registered pharmacist. So who is the registered pharmacist? Who have got the basic qualification of pharmacy, and then an experience, an internship, and then a program of training. And that is a registered pharmacist. And what he has to do after getting the prescription, because of his background, a pharmacy graduate or a diploma graduate nowadays, and as well as the PharmD, they are to use the knowledge and analyze the prescription. The analysis should be so intense that there should be very all attempts to find out any lapses in the prescription. I said lapses, not mistakes. Lapses in the prescription. You all know a doctor is busy and he has little time to spare, and he will quickly write. He is more focused on diagnosis. After his diagnosis, he will straight away write the medicines to the patients. So now what happens after this prescription will come to a pharmacist. And here we see the main difference in India and in the other developed countries. The people are very much aware of the ill effects of the drugs. Here, people consume drugs as nothing is going to happen them. Despite of our awareness, jatas, all these things, nothing has changed in the world, especially in India. Why? Because we don't consider health as the priority unless we are challenged with. So that is a major reason, and we have to make it happen. So now these drugs are handed over to a patient along with the advice. That is called as community practice or community services. For this, a registered pharmacist in Canada is earning 5 lakhs per month, and a registered pharmacist in USA goes up to similarly that amount. In Australian government has recently announced 18 Australian dollars for analysis by of a prescription to a patient. So this is how this profession is become very active. So anyone who goes out there abroad, he will try to become a registered pharmacist and earn a good money. Because it is knowledge-based profession, one has to read constantly. So their licenses are also up to a mark. Means they are going to be closed. They are going to be closed after 1 year or 2 years. And then they say that you again reappear in the exam. It is not continuous. Once the license is given, it is for life. That is nowhere concept. It is meaningless. Because the drugs which I was saying, after 2 years, the new drugs have come and old drugs have gone. And I should learn about this. Unless you make a person proficient with the knowledge, he cannot practice effectively. That's why in Canada or in USA or in Great Britain, anywhere, they have to clear a licentiate examination very recently. Then only they will be allowed to practice. So that is why the things are happening. And let me come to what is happening now. What is the situation in our country? I told you already. We are having a product-centered market, and we don't have what is we have a product center market. We don't have a patient orientation. That is the major challenge what we are facing it. Now, in order to make the patient centered, what we should do? We should change the trading order. The business model should be changed. The business model in the developed countries, we have to follow it. There is nothing wrong. Accordingly, our government has passed a law called as Pharmacy Practice Regulations, which I want to discuss about it. Please come to that Rajya Patra. You move the chair, yeah, this one. No, this is not the first slide, yeah. See, this is Bharat, see, why are you, this is Bharat Rajya Patra, the Gazette of India. So it is applicable to whole of India, and it is called as Pharmacy Practice Regulations 2015. In 2015 only, we made this law, and we hope that things will going to change in the country. And unless we take an interest, nothing is going to change. This is what we have realized. These laws there, but I'm going to talk about this law, but implementation is in your hands. You have to take a volunteer and you have to break that ice, because teachers can only do this, because the current pharmacists, they don't have knowledge, they don't have orientation, they are only interested in the sale of the medicines. If they sell 1,000 rupees, 200 rupees profit they get. If they sell 10,000 rupees, 2,000 rupees profit they get. Apart from that, there is no need for him to explain. The patient also doesn't know. But the drugs are very, very technical matters. They need to be observed very carefully. They need to be given very cautiously. And patient has to follow certain things while using these drugs. If he is not using, then it is a mistake, and it is going to cost the health and also the life also sometime, which our Madhav Bhatt will talk to you. So I'm going to have the next slide, please. Here at the bottom of the slide, you have the definition of pharmacy practice. Pharmacy practice means interpretation, evaluation, and implementation So interpretation, what to interpret? A prescription is there. That interpretation has to be done by whom? A registered pharmacist. That's why people who are giving certificates and sitting home and doing other job, they should be put under they are violating the law and they will be punished. Recently, I happened to be in the KSPC, Karnataka State Pharmacy Council in Vijayanagara in Bangalore. I happened to meet our registrar, Mr. B.G. Shivanand, and he has called somebody on in his this thing, and there was a person who has rented his certificate, to somebody, and someone who has got no idea about the pharmacy is paying some money to this person, and he is happy with that because the certificate is earning and he can do another job. So like this, we are seeing very worst model. See, the people are missing the care, community care by the pharmacists. That's why pharmacists have no identity in the society. In our society, nobody is going to identify who is the pharmacist. Doctor, yes. Nurse, yes. Pharmacist, who is he? Such a situation we have caused, and we have to wipe up that by going to the people, by going to the public. So that's why we have taken the teachers as the model, because teachers have excellent knowledge. They have the enough background to analyze the prescription, because they study everything and they will be studying everything along with the students. So with the help of the students and teacher, they have to go to the community and they have to help the people. Can I have the slides presentation? Slides have vanished. So I said interpretation and evaluation and implementation. And interpretation, each prescription matter has to be then you have to evaluate it and then you have to do it. So this is how the pharmacy practice has to. And in this law, according to law, please, I am going to inform you what is there in the law. There is in the second, madam, you have moved the slide ahead. Please move back. Go to the second slide. We are in the third slide, I think. Don't change the slide. Who are changing slide? You come to the slide number 2 in this act. There is an important point I want to discuss with everybody. Where is that slide? Who is this changing? Yeah. At the bottom of this slide, you get an information that a pharmacist has to participate in the selection of drug and devices. The day is not very far off when we are called by the doctor what drug to give. It is already happening in America, in Canada, and everywhere. And because it is risky to choose drugs without having proper knowledge. If anything happens, the doctor has to lose all his lifetime earning. And also, this law empowers us to administer drugs along with nurses. So we are being asked to provide information to doctors. Suppose we have a knowledge, then only we can share. If we are having just a focused knowledge about industrial practice or something else, we can't do anything. So please take an interest, and information is available, but interpretation and what is suitable for the patient and how to implement it is in the hands of the registered pharmacist. So that's why the developed countries, they are paying so much of money. Can I have the next slide, please? So, code of pharmacy ethics. So every profession has its own ethics. Dharmo rakshita rakshita. So here I have got one small incident, small personal story to share with you. My father was a pharmacist, and in 1964 I was already 9-year-old boy, and I used to go to pharmacy and sit there in my free time. And what used to happen is my father used to discuss and how he became a pharmacist is also a very strange story. In 1955, the government of Karnataka and the Pharmacy Council of India, they opened up the pharmacy profession for all those people who can read English and write English. This is not enough. And for them, the Government College of Pharmacy their 3 weeks training was arranged. In 3 weeks, whatever they could learn, it was been given, and they have been given license and asked them to go and open a shop. Like that, my father became a pharmacist because there are no pharmacy colleges, there are no infrastructure, and country wanted a pharmacist in large number, so they made a stopgap arrangement, and so many people from various cities came, and they were given 3 weeks training, intense training, and they are given license. After this, my father opened a medical shop in Harihar, his native place, and there was he also has 3 weeks. How can he learn everything in pharmacy? What we are taking about 4 or 3 years or say or 6 years. So my father had a clever businessman, and the medical representatives who used to visit doctor to promote, to detail the products, they also visited the pharmacy shops. So at that time, my father befriended with these people, and he asked them what they discuss with the doctor. So they tell again, and it becomes so common. Within 4 or 5 years, my father was having a complete product knowledge without going to any college, what to be done, what not to be done. All these information he has in, and he became a resource person for the doctors. Later on, he became a resource person for the doctors, and they used to ask about this. This is an SSLC dropout person. After 5 years in the business, he can learn so much that he can share the information with the doctors, and this is what the things are there. And he is also very good businessman, and also he was ethically very sound. So why I'm telling you ethics are very important, because there is a one small, very, very important message. We must take it today, and you should follow it throughout our life. Our profession, our progress, everything depends on our affiliation to good ethics. So we must always learn and adopt good things, although they are not popular things, they are clumsy things, they're going to harm us, means they're going to go, they for them we have to waste a lot of time, like that it appears. But even then, that is very, very important. In those days, the snake bite was a major killer in my area, and villagers used to go into medical shops in search of anti-snake venom. My father used to order anti-snake venom and keep it in the shop. And whenever, so nobody used to keep it, because that injection was 500 rupees. In 1955, 1963 or 64, 500 rupees was a big amount, and he used to keep it. And for your science information, Hafkin Institute used to give it, and 6 months of the expiry date. After 6 months, all the 500 rupees, whatever my father has invested, will become zero, because it is not consumed. But still, my father risked and kept that injection so that he can save a person's life. So like that, many a time, night times, we had the knocking on the doors for collecting the injection, and father became a very popular among this thing, and he was very popular as a pharmacist in this thing. So in the course of his career, he became rich and prosperous, so that he became medical shop. He became a very small learning place for him, and he entered into the manufacturing, and also the trading of paddy and seeds. All these things he did, and he had a very good time, and was very prosperous. You must understand one thing of the nature: whatever is prosperous, whatever it reaches the peak, it has to come down. The same thing happened in my father's life. He became pauper. People cheated him, and when he was having a lot of debts, he has nowhere to go, and he came to medical shop, because he has learned it, and he is still having the knowledge of that. So when he came to medical shop, the fellow who was in charge of the medical shop has also left empty cupboards and lot of bills to be paid. So like that, my father in a great deep trouble. So at that time, the people of Harihar, who have seen the ups and downs of Dr. Mr. Nagappa, they wanted to keep him in the business. What they did is nobody told them that they have to do like this, but they only realize that we must somehow protect this businessman. He is very useful. And if he is useful, then we will also be safe under that. See, the community, we say that nobody understands why we should serve and all these things, but community is there, alive, watching you and taking the decisions. What
Hello, sir. Hello, sir. Actually, we are unable to hear you.
I think his video is
I
frozen.
think some server issues, sir.
Yeah. Let's give him a couple of minutes, you know.
Oh, okay, sir. Okay.
Do you guys want to call him and find out what is happening?
Ma'am is calling, sir. Can you
Oh,
give
okay.
us another minute so that we can
Yeah,
get
sure.
back?
Yeah, otherwise, you know, till
Yeah,
he comes. Till
ma'am
he
is
comes
trying to
back.
reach him, sir.
Okay, sure, no problem. Well, do you guys know that, you know, in India, there is going to be a vaccinator available in a pharmacy? Do you guys know about that? I didn't get any answer.
Sir, please log in, sir.
What I was asking is that are you guys aware that a pharmacist is going to give the vaccines in India? There is a pilot project started by the Indian Pharmaceutical Council that somebody from Australia is going to come and train a pharmacist. Dr. Nagappa is back. Yeah. Dr. Nagappa, you are mute. You need to open the mic.
Thank you.
Okay.
The code of ethics, I think I will go for the next slide. Can you please push the slide to the next one? Yeah.
Yes, sir.
You are all, see, you moved, yeah. Professional services. In India, also, we can collect the amount for paying the services. By giving the community pharmacy services, we can collect. The government, as per the law, payment of services is very much possible now. So now we have to connect these points. So payment of the is a thing in which we are to make a fund for the government of India should start paying for the services, because doctors and nurses are paid for their services. Well, while pharmacists are not paid for the services, this is how the pharmacists are not motivated to give the services. They are only interested in the sale of medicine. So the law permits them. So if you are a registered pharmacist and if you do in your free time, because we have seen doctors and nurses practicing outside their regular job. And here I also discussed the same matter with the Mr. Shivananda, Registrar of Pharmacy. So they can practice, we don't have any objection, but they will not be given license. License is a different thing, practice is a different thing. So one should not mistake that if I practice, I'm doing an illegal thing. So anything, any knowledge you have, you can practice after you are a regular job. After your teaching hours in your home, Saturday, Sundays, you can practice. And I have practiced so far from 2007 onwards. No one have come and asked me who have given you the permission to practice. So, dear friends, please don't mistake. You can practice, and it is legally permitted, and you can also collect money. See, it is a new thing. When we started newly, several experiences we had. So we had a self-doubt that we are not capable of giving knowledge to this thing. But when the prescription was in front of me, I got so many ideas. And when I interacted with the patients, I got so many ideas. And see, one of the idea was, we used to go the home medication review, means home visits we used to make it. So it's a voluntary job. So myself and my colleagues, one day we used to select, usually Sunday morning we used to go along with 5, 6 students. We used to visit the patient's home, and then we used to discuss with the patient there. So when we discussed with the patients, we got so much of enthusiasm and so much of insight, because our biochemistry knowledge, our human physiology knowledge, whatever we studied in the books, whatever we have taught in the classes, came to our use, and we were, without any hesitation, I can tell you, we were much confident to talk about the nutritional status of the patient, and also about the health of the patient, and then about the lifestyle changes. All these things we could talk very confidently. We can talk. From where this confidence has come? It was inside me. It came out because I saw a person having mistakes or problems with that. So as a result of it, I was very enthusiastic, and I helped so many patients. And about this one small story I would like to share. See, in this we were going in the home to home visit. In that, we entered a home where there were 79-year-old husband and 70-year-old wife were there, and wife was bedridden and she could not move because of this thing. And the husband was with great difficulty. He was making the household chores. Unfortunately, both the children of this couple were staying abroad, and they are sending good amount of money. They don't have any economic issues. They have money, but they don't have a service. So just I asked them, did they go to the doctor? Yes, we went to doctor, and what he has given. So prescription we took, and in that everything except protein was there. He was given B complex, A to Z vitamins, and all those things were there, except the protein. And then protein has to be given. This lady is suffering from malnutrition, lack of protein. And usually the Manipal, South India, so they are more fond of rice, rich in carbohydrate. They used to eat carbohydrate in the various form. So they used to eat idli, they used to eat dosa, they used to eat anything they eat. Carbohydrate is the major problem. So today is the World Millets Day. The millets are one of the very good savior of our life. So Millets Day is celebrated by our Prime Minister Modi today. So whatever he does, it becomes a trend. So let us see the nutrition. About nutrition also, Dr. Mahadev Bhatt has an interesting story. And what happened to these people? And I looked at the prescription, and there was B complex, there was minerals, there was again duplication. Duplication of the same thing was there. And moreover, weekly twice, she has to take neurobion injection, intramuscular. A lady with 70-year-old with little muscle mass, it was a very, very painful experience. And she used to come in tears when Wednesday and Saturday used to come. So I told her that, don't worry, let us look into the protein. So I told her, you take a fistful of moong. Moong is the green gram, unsplit green gram, and you soak it in water in the night. In the morning, you eat it. So you have to do it for 15 days, and let us see what will happen. So after 15 days, when we went next time, the lady was very agile, she was very active, and that moong has done a wonder. What is there in the moong? The moong has got a balanced diet. It has got less carbohydrates and more proteins. So the idea that the protein, see in her diet, I checked the diet. It was carbohydrate, 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 or fat. टेस्ट के लिए फैट है और ग्लूकोज के लिए कार्बोहाइड्रेट है एंड प्रोटीन वी कैन नॉट सिंथेसाइज वी हैव टू गेट इट फ्रॉम द राल्स lentil legumes or non-vegetarian or something, but the vegetarian so उसके लिए green gram is the best way. And the and she got up in 15 days and within 15 days I could cure her disease and her quality of life I could improve by my knowledge. And what happened next? And she came and make a tea for all the whole team. And we were discussing, and then we said that now you take only one B complex, one mineral tablet, and no need for injection. So she was so happy, and like that we could and improve a quality of life because our knowledge is useful there. Because of our background, we have got a knowledge. And we need not, if there is a doubt, we can always refer. Nobody objects. So in several cases, when we found some problem, so we used to tell them, we will come next week and give you the answer. Or else to phone, we used to give them the answer. So this is how the things have to be integrated. And this is how we have to make a mark in the patient's mind. Patient should realize what a great pharmacist. For this also, I have got one story. I went to Vancouver. I was the member of International Society of Oncology Pharmacy Practice. You might not have heard the name also. PharmD people also would not have heard. I was the board member of the International Society of Oncology Pharmacy Practice, ISOPP. So they used to conduct meetings in various places. In some year they conducted in the Vancouver. In the Vancouver suburb, there is a small village called as Kamloops. And one of my good student, Pradeep Damodharan, who has done diploma, degree and MPharm, and then went to Canada and settled in Kamloops. So in Kamloops, he established his own pharmacy and by his services. And his wife also is also a pharmacist. Both of them were serving the people. And I went to his medical shop and I saw that people are queuing up after they have given the medicine. In India, what happens? The people will run away from the pharmacy. But here, people are queuing up with the prescriptions and they wanted to discuss with the pharmacist what is there in the prescription, how I should use the medicine, and if I got any problem, whom I have to report, what I should do in case of a problem, in case of emergency, everything. The people are very much cautious about their health. So such a awareness, we have to bring it among the people, and Pradeep would answer one by one and solve all the problems. So this is the way the pharmacist, and he used to recommend for nutraceuticals and all. This is the way we have to establish our profession like in other developed countries. Can I have the next slide, please? So this is already explained. Actually, the exclusive right to talk about prescription is to the registered pharmacist. Please understand. Registered pharmacist is a very powerful professional status. And this status comes by your qualification and your internship. See, there is an example in the neighboring state. There is an IAS officer by name Zigade, and he is a non-pharmacist. And what he did, he was made in charge of the FDA. In Maharashtra, the Drugs Control Department is called Food and Drug Administration. So there he was in charge of FDA, and he picked up the Pharmacy Act 1942 or 1947, and in that he studied. And one thing which struck to his mind is only the registered pharmacist can dispense the medicines, no other than this thing. Then a registered pharmacist was necessary in the medical shop. isn't it? So he made it compulsory, mandatory that every medical shop should have a registered pharmacist. It caused a havoc. It caused a havoc in the pharmacy things. Usually, the people, can usually they hire a certificate and they run their medical shop. For them, it was a big trouble, and they had to close down medical shops. And the pharmacist salary went up double. So they are getting around for lending certificate, they are giving around 5,000 rupees. Now they have to pay 30,000 rupees. So then the pharmacist should be there in the medical shop. And unless the pharmacist is there, then only that medical shop can be opened. Otherwise, he has to close down. So this is the law. You please understand, Pharmacy Act clearly mentions the pharmacist should be there, should be present. If it is not there, then it cannot be there. Then all these things are there. So we have that is a very important point. And other points, I think, over utilization and underutilization. So doctors are not aware about the medicine. Please understand. Doctors are not pharmacists. They don't study so much about our medicine. They study about diagnosis, anatomy, biochemistry, all these things. But about drugs, pharmacist is the only person, only profession where it takes the responsibility from making to end user thing. So that's why the pharmacists are always given the responsibility to check a prescription whether the given dose is more or less. So then you have to immediately call on the doctor and ask him to change the prescription or rewrite the prescription. And therapeutic duplication. So like that in the B complex, you find out that the Berocin C was given, B complex syrup was given, and folic acid with the B12 tablet was given. So like this duplication should be avoided, and other things all there. So can I have the next slide, please? May I have the next slide, please?
Just a second.
Be alert, madam. Don't run away. Because continuity should not be lost.
2 seconds, sir. Not showing.
Now we know that law is there and its implementation is not there. See, the government of India wants it to be implementation. So because they put a pressure on Pharmacy Council of India, principals who are there in the colleges, they all got the circular along with the state pharmacy councils saying that the registered pharmacist should practice pharmacy profession. Somebody in the Bihar put a public interest litigation about who will give me the drug information. So there the Patna High Court gave a very strict order that pharmacists should practice. Why they are not practicing in our country? So this is how the recent developments are there, and this is about the status of the pharmacist. And okay, the slide is half visible. What to do? So rational drug use is also a very important thing. So drug should be prescribed and checked whether it is rational to use, because Goodman Gilman, the Bible of pharmacological basis of therapeutics, from first edition to the latest edition, in the preface, they clearly mention drugs are harmful. You can only use it if it does more good than bad. If it is doing bad, then less good, such medicine should never be prescribed to the patients. So risk-benefit analysis, depending on the goodness of the medicines, one can prescribe a medicine and one can use the medicine. Can I have the next slide, please? Change the slide. So this one I don't want to speak more about it. Can I have the next slide, please? Counseling is very important. I told you the implementation, evaluation, and implementation and interpretation. Interpretation is the first thing. and evaluation is the second thing, and the next third step is the implementation. Can I have the next slide, please?
Slide, sir. You don't
Yeah,
want
next slide.
11
Change
point?
the slide. Change the slide, madam.
Okay, sir.
I think the punishment also is there. After duty, there is, if somebody does unethical things, and if it is improved unethically, then he will be punished. Okay? So
This slide.
unethical, this thing, and come out of this slide and come to the WHO FIP module.
Okay, sir.
Yeah. Yeah. Stay on this slide.
Okay,
Go
sir.
back.
Go back. This one?
No. That diagram was there, flow diagram.
Okay, sir.
Flow
This
diagram.
overall quality of life?
No. I don't know. This is not that one. Next.
Number
Yeah,
26.
this is the one.
Okay, sir.
By the WHO and FIP. In 2004, they proposed this, telling that how the pharmacy practice should happen. In this is called as WHO FIP model, and it is there in the handbook of pharmacy practice, handbook for pharmacy practice, which I am going to share with you in this WhatsApp group. And there are around 7, 8 this thing. In this thing, it is different from medical practice. Please understand. This is different from medical practice. Here, the patient will come to the pharmacist after he gets a prescription, and interpretation, evaluation, and implementation a pharmacist will do, and make a customized plan for the patient. And he asks the patient to go home and see him later on an appropriate interval. And patient comes, and again the pharmacist will interpretation, evaluation, and the implementation. He will find in that he will understand that if the quality of life is not improved, if the drugs are not working, if the prescription is not working, he will try to find out what is the problem. If it is a drug problem, then he will solve it. If it is a problem with the diagnosis, the case will be referred to the doctor. And if it is nursing care, nursing professional will be called upon. So this is how the things have to be given, and it should be given for 3 months. So 3 months, in that 3 months, how many visits will be there? Maybe 9 visits maximum. Every 10 days once visit means 3 months means 9 visits. So in these visits, he will learn what is pharmacy, and he will also understand what is the potential of the pharmacist, and how he must utilize the pharmacist for his services, and like that. And within 10 visits, the patient also tries to learn self-management of his condition, especially diabetes and hypertension. Self-management is more important, and this has been taught in 9 visits. So this is the patient education or patient counseling, whatever you can call it as. Can I have the next slide, please? A case is there. So someone should read the case so that I will have some free time. Can anybody read this slide?
Sir, am I audible?
Yeah, you are audible, madam.
Yes. Mrs. W, a 53-year-old woman, has had gastrointestinal acid-related disorders diagnosed by endoscopy. Mrs. W has a history of asthma, hypertension, duodenal ulcer. Her current drug therapy includes amlodipine, 10 mg in the morning, salbutamol inhaler, 2 puffs as required, and beclomethasone inhaler, 200 micrograms twice daily, and theophylline 300 mg twice daily. Mrs. W has recently undergone successful
H. pylori eradication therapy, which has been confirmed by carbon urea breath test. Mrs. W smokes 10 cigarettes a day, has a body mass index of 35 and does not drink alcohol.
Okay. So one more time, somebody else.
Mrs. W, a 53-year-old woman, has had
First case study. Yeah, madam.
endoscopy. Mrs. W has a history of asthma, hypertension, and duodenal ulcer. Her current drug therapy includes amlodipine, which is 10 mg in the morning, salbutamol inhaler, 2 puffs as required, and beclomethasone inhaler, 200 microgram twice daily, and theophylline, 300 mg twice daily. Mrs. W has recently undergone successful H. pylori eradication therapy, which has been confirmed by carbon urea breath test. Mrs. W smokes 10 cigarettes a day, has a body mass index of 35, and does not drink alcohol.
So move the slide up. So whenever we get a case, we have to divide this case into 3 parts. The slide movement has not taken place. Drug factors, disease factors, and lifestyle factors. So let us look into the lifestyle factors. She is obese, and if you tell her that you are obese, you have to reduce your weight, you eat less, she's not going to listen to that. And how we have to educate a patient? The education of the patient should come from connecting the current suffering of the patient with the habits, lifestyle habits. Because she is smoking 10 cigarettes, that 10 cigarettes contains nicotine, and that nicotine is irritant and causing the secretion of the acid. And this acid, which comes in the windpipe, will burn. So how do we connect this? So how do we make the patient to understand? See, slide movement is not there. What is this? I've been requesting you. Move the slide. Yeah. So you have to divide into lifestyle factors, drug factors, and disease factors. So how we have to counsel? So now lifestyle factors, and she is a smoker, and she is taking a heavy dose of nicotine. And if the nicotine is cut down, you can't just say that stop smoking. How to connect this to the patient condition? She is getting GORD, the burning sensation in the esophageal area, because the acid is there and it is getting stimulated by the nicotine, and it is entering into the lungs and causing a problem for the patient. Heavy pain is there. So if you tell the patient that you reduce the smoking 50% and see any improvement in your burning sensation, so she will definitely would try to do it. And when she does it like that, she will find a relief for the burning sensation due to acidity problem. Cigarette smoking by 5, and then she will be feeling less episodes of the acid bump into the esophagus. So these are and the drug factors. As you know that I mentioned you already that we study medicinal chemistry and also the biochemistry and all the chemistries, whatever there in the drugs we study, and we also study the dosage form design. So many knowledge, variety knowledge is there, all aimed to make the patient care a simple affair. So we have got the drug factors. So in that drug factors, doctors have prescribed amlodipine and also the theophylline. See, the theophylline is a cousin of caffeine, and why she should be on caffeine. And regarding the theophylline, you know that it is very closely related to caffeine, isn't it? So this you can know, but what about the doctor? What about that? They don't know about these things because they didn't study them. So theophylline, you know, and then you can. So is there? See, what for theophylline, what for amlodipine is given to manage diabetes, to manage hypertension, and theophylline for management of the asthma. So there are many good asthma agents which does not behave like theophylline or like amlodipine. So those drugs should be substituted with the help of a prescription changeover. So we have to discuss the doctor about this, and doctor will change the prescription, and it will be a good relief for the patient. Coming further, lifestyle factors. Lifestyle factors, the in the lifestyle factors, one has to understand that the patient is cured of the GORD, not the H. pylori infection, and there is no GORD is there. In most of the patients who in asthma with GORD, it is observed that the acid which bumps into the esophagus will also enter the lungs and cause the acid stimulated asthma. In such cases, we have to again evaluate when the GORD, when the H. pylori infection is confirmed by urea breath test. What is urea breath test? Radio labeled urea is fed to the patient, and the H. pylori infection is there, then it will be hydrolyzed. Urea will be hydrolyzed to carbon dioxide and ammonia, and the patient will be having, sorry, the urea breath test means the urease, an enzyme which present in the H. pylori is not present in the human beings. So in case the urea is fed, radio labeled urea is fed, it will be hydrolyzed to urea, ammonia and carbon dioxide, and radio labeling of carbon dioxide can be detected in his breath. So as he is negative in this test, it clearly mentions that there is no H. pylori infection. So H. pylori infection is eradicated. So now there can be also, there is no need of the asthma because acid used to bump up and then enter the esophagus to the lung pipe and then cause the asthma. As this is being stopped, we have to evaluate the asthma. How do we evaluate the asthma? There is a small handheld P flow meter, and you ask the patient to blow in that and record the respiratory volumes. If the respiratory volumes are healthy or par with the healthy volumes, the patient is not suffering from asthma at all. So theophylline, beclomethasone, and all these things are unnecessarily the patient is taking because asthma is not evaluated properly in the patient. So so now you can do the test and you can suggest the doctor, you please find out she may not be having any asthma. The doctor will test in his lab and he will also in his clinic because that is a handheld P flow meter. And he will also find that she has got no asthma because her respiratory volumes are very good. So now all anti-asthmatic drugs are taken away from her prescription. What a big relief. No beclomethasone, no theophylline. All these things are salbutamol, all these things are removed. And this is how the things are to be worked out, and you can help the patient and and also you can this thing. So this is how the case study goes on. Can I have the next slide, please? So home medication review, I leave it to our mother, but there are some photographs are there. I want to show that. I already spoken about this. Next slide, please. So this is the home medication review. So where myself and our students used to visit in 2007 onwards. So we used to get a good response from the patient's home. So every week we used to go and check, and we used to help the patient and we used to correct, we used to check the drugs, how they are storing it, and whether they are in a proper condition or not, we used to check. So all these services we provided. Can I have the next photo, please? Can I have the next slide, please? Okay, so the benefits of home medication review. You can directly speak to the patients and you can assess the patients. You can make a good intervention because it gives you an opportunity to visit the home. Can I have the next slide, please? Yeah, I think I finished. Thank you very much. So these are all the home medication review papers. You can find so many of them. So home medication reviews. And thank you very much for your patient hearing. Now I'll request our Mahadev Bhatt to speak about his experiences in community pharmacy. Please, after this course, after this lecture, you please start pharmacy practice in your home, in your neighborhood, in your own family members, and see that their health is maintained properly. Thank you very much. Okay.
Thank you, sir.
Mahadev Bhatt.
Thank you so
Mahadev
much.
Bhatt. Okay.
Thank you so much, sir, for this vibrant and wonderful session. And thank you for making all of us understand the importance of pharmaceutical care with case studies also. And we would be really happy if you could join with us one day and share your innovative ideas with us. Thank you. Thank you so much, sir. I now request Dr. Vaishnavi to introduce our next speaker, Dr. Mahadev Bhatt. Over to you, Vaishnavi, ma'am.
Yes, ma'am. Thank you. I would request a 2 seconds time. I just want to share the sir's profile in here. Am I audible?
Yes, yes.
Yeah, thank you. Is sir's profile visible?
Yes, it is.
Yeah. Welcome, sir. Veteran clinical pharmacist, Dr. Mahadev Bhatt is a retired clinical pharmacist who has come to USA right after his pharmacy graduation from LMCP in 1972. He has been most part of pharmacy over last 50 years in USA. He has 18 years of experience in industry in various positions such as R&D, plant manager, operation manager. Over 8 years, he has owned 4 community pharmacies with the home healthcare, injectable preparation, diabetic care, asthma care, osteoporosis center, breast cancer counseling, geriatric pharmacy care, hospice care, etc. He joined Walgreen Retail Chain Pharmacy in 2003, prior retiring in 2015 to 2016 from Walgreen Pharmacy. So welcome you to our webinar. Thank you so much for being with us. Over to you, Anju ma'am.
Mahadev Bhatt, you can just take over the session.
Mahadev Bhatt, sir, you can just take over the session.
Okay. I'm quite sure that all of you can hear me. Is somebody going to put up the slides?
Yes, sir.
Okay.
Just a second. I will put
That's
your
okay.
slides on.
Yeah, you can get ready with this. Okay.
This is your presentation, right, sir?
Yeah, there are 13 slides and we are going to split this slide number 12. And I will tell you when to change it, okay?
Okay, sir.
Now, I got graduated in 1972.
Okay.
Now, if anybody cares to look at the syllabus in 1972 and what is your syllabus now, you will know that you guys are a lot smarter than me because you have studied a lot. And I must congratulate all the pharmacy teachers that you have made India proud to be the pharmacy hub of the world. But what does that mean? It is the delivery of the finished product to the different country. But it doesn't mean that it goes to the consumer. Now, what Community Connect means is how do we deliver the drug to the consumer? And that's what we are going to talk about it. I'm going to give you 3 news. You know, I was in India, I think in February, and I came up to Mysore. And at that point, I found out, I think Dr. Joshi had a 2-day seminar, you know, I was attending that Indian Pharmacy Association has taken up a project that pharmacy students can be a vaccinator. The first vaccinator of India is going to be Raj Vaidya from Hindu Pharmacy in Goa. He is being trained at Mysore Hospital by some people coming from Australia. It's not a long training, you know, maximum you need is 7 hours, you know, maximum, you know. So that project is going on. That is a pilot project. There is another pilot project going on called Pharmacy Clinic in Uttar Pradesh. What government wants that how can we reduce the price of a medication so the people can afford the medication. And there are certain clinics opened, and B Farm graduates or a pharmacy graduates, they can open the shop and they can communicate with the doctor to change the medication so the people can afford it. The doctor writes a prescription, the guy goes to the pharmacy, he is being discharged from the hospital, and the medication costs 500 rupees. They have got only 50 rupees. So they will say, give us 5 tablets or 2 tablets, we will see how does it go. And the patient will never take the medication. Number 3, there is a person, I think your staff should know, her name is Dr. Preeti Tagade. She is president of PRISAL, PRISAL. She was on a national television in India called Doordarshan. And she was last week, and she was talking about how does a pharmacy graduate can help a patient to get a cheaper medication. Can we have the next slide, please? Hello? Okay.
Yes, sir. Due to the slow connectivity, it would take
Sure. No problem. No problem.
Yes, sir. Thank you.
The way we are going to go through is that this is the teamwork. Some of the slides I am going to go very quickly, and then one slide I will spend a lot of time, which will be a clinical example of a blood pressure, and there I will incorporate everything that how this is being done.
Yes, sir.
You are a D Farm student, or you are a B Farm student, or a Farm D student. It doesn't make a difference. You have got blessings from the State Board of Pharmacy that you can touch drugs. All 3 of these people, they can touch drugs. Well, everybody says drugs are dangerous. Yeah, I do believe that they are. That's why we have got a special training. But when it is taken in the right way, then it can save your life. So decoding the pharmacy services, that's what it means. Now, why did I say wind blowing from the west to east? As I said, I came here 50 years back, right? I got educated in India. Every other community pharmacy in this country is Indian. Trust me. And there are certain chain store like Walgreens and CVS and all. You know what they tell you at Walgreens? You are employed here, but do the business the way the Indian pharmacy is doing the business. That's the reason I wrote down wind blowing from west to east. Now, there are certain names here, BMR, HMR, MTM. You might have heard before. It's a brown bag medication review, home medication review, medication therapy management. Let's go to the next slide, please. You all know what are the 5R, you know, right medication, right person, right drug, right dose, right route of administration, and right time the drug is given. But I put there +1. What is that +1? It is the communication what you can have with the guy who has written a prescription. Otherwise, how are you going to change the medication? If you are going to stay in water, you cannot fight with a crocodile. Or if you are in an ocean, you cannot fight with a crocodile. Crocodile being a doctor. So you have to find a way that how you are going to help the patient to have a medication which is affordable by him and which can be taken by him at his convenient time so he can get better. Why do we have to have a medication review? Well, so you can find out what is the reason patient is not getting better. You can find out, are they taking medication because they don't need it, or their symptoms are not there anymore, or you can avoid the wastage of the medication. Doctor might have said that take aspirin once a day, you know, and then the patient went to the doctor second time and the patient says that, oh, you still have pain, take medication 2 times a day. So now patient is taking medication 3 times a day because he says 1 time I continue, next time he said 2 times, I can take 2 times. So he will put 2 + 1. There is an incidence in America that one person took 17 aspirin every day. And then they found out how come he got an ulcer. Because every time he went to the doctor, and he says, can I take more? He says, yeah, you can take more. So 3 became 4, 4 became 5, 5 became 6. So that is why you do the review. Can I have the next slide, please? Well, pharmacy challenges. You must have heard a lot of things on TV in India that online pharmacies are selling a lot of things at a lower cost, you know, so all the drugstores are complaining. But here you do have an opportunity. Can you offer them something more so the person can come to you again and again? And this is the opportunity do you have? That do you love what you do? Do you love pharmacy business? Do you want to see that 5 hours are being conducted? Do you want to talk to the doctor? And these are the things online pharmacists cannot do it. Now, I like to come back to the clinical example, so we will incorporate everything into that. Okay, next slide, please. Well, think about this thing. Okay. This is going to be a money-making issue for all of you. If a prescriber can go to make a house call, why can't we go to the house call? Just imagine that you visited somebody, you checked all the medication in the house, over-the-counter medications and the doctor's medication, and you wrote down all the things, you know, which I said, BMR, HMR, everything. And you'll be surprised that some of the medication patients are taking, even though their doctor has asked them not to take. The very good example is a antacid tablet. You know, he may be taking it, but does he know that what kind of antacid it is? Are they taking a proton pump inhibitors like Pepcid or Esifax or Pepcid is not a proton pump inhibitor, it's a Prilosec, you know. If you take that medication more than 6 weeks, people start losing hair. When you go to somebody's house, you can find out what is their lifestyle, what they are eating, you know. And if you do this service, you can get paid. Say you want to charge 500 rupees a month, you visit somebody's house twice a month, you take your blood pressure machine and you take your oximeter and you take your blood sugar machine, you check it, you straighten all the medication out, and then if they are running out of medication, you can go and call the doctor, and people will do it. People will pay. 500 rupees is not a much thing. Suppose you have got 10 patients like that. How much money you make? And as a matter of fact, each and every pharmacy teacher should do that. If once you are a registered pharmacist, do you love pharmacy or you just want to do teaching all the time? The research is there. The students are going to study. The books are there. But how are we going to get the medication to the consumer in the right way? Think about it. There is a person in Pune, Dr. Anantanayak Nagappa, trained her. And I think now she is somewhere in some other country, but she practiced for 3 years. She had a pharmacy clinic. She had 125 patients. She used to charge 1,000 rupees a month. Imagine how much money she made. The next slide, please. I did talk about data versus analysis. If suppose somebody asks you, give me an opinion, you can only give your opinion if you know something about them, So how to collect the data? A very simple way is that ask the guy that if you want my advice, put all the medication in a brown bag, bring it to my pharmacy, and I will take a look at it, and I will tell you what it is. If you are going to go to somebody's home, you have a HMR. If you want to tell them which medication to be taken at what time, that will become the quality use of medications. Suppose there is an adverse drug reaction, you can talk about that too. The next slide, please. Now, these are the important things you should remember, because when we come to that case study, you will know how a pharmacist can perform. Now, what is the application to the consumer means? You target a medication. You take one molecule and you follow it up. And you see that how it is helping them. And you inform the prescriber. Now, either you can target a medication or you can target a disease. Diabetes mellitus, blood pressure, anticoagulation, seizure medication, asthma medication, overuse of antibiotics and steroids, long-term care, birth control medication, plus antibiotics. That's a big thing. I'm going to talk about that separately. Antifungal medication with quinine. I will also give you one example on that. The next slide, please. Now, I'm going to spend some time on this one, okay? Whatever I talked about in all this previous thing, and I went through that quickly, and I think I did talk to your associate professor or assistant professor Madhavamma that, give this chart, all the things, print out and give it to all the students. You guys can keep it,
Okay, sure, sir.
and then they can study. This is a real life thing happened to me, I think in 2016 or 2015, I think it's in December. So it should be 2015 because I retired in 2016 in the month of May. It was a long weekend. and it was a Thanksgiving day. So it should be November. It's a 3 days holiday, and generally all the families get together. So all bunch of uncles and aunts and everybody come into the house, and they will just compete with each other that I bought this saree and you bought this dress, and my husband makes more money than you, and my son is more smarter than you, and then they fight, they eat a lot of food, and they go home. It was that particular weekend. And we in pharmacy, we know that people will start getting sick on the second day, and we will have a rush after 3:30 or 4 at the pharmacy. It was around 2:30 in the afternoon. I was in the pharmacy, and I had a help. Her name was Isha. She was my senior tech. By the way, senior tech makes around $35 an hour. And me being a manager there, I always took advantage of the situation that I have got the best possible help. Every healthcare profession in America has to work every other weekend. There is no if and buts about it. Okay. Now, there are two people who enters into the pharmacy. One is a 14-year-old girl, and the other one is around 40, 45. And they wants me to check the blood pressure because we check blood pressure at no charge. Now imagine that if you put that sign in your pharmacy, you know, what can happen? The younger girl could speak English very well. They were Hispanic, so they were speaking Spanish. I cannot speak Spanish that well, but I can understand everything in Spanish because I have stayed in California for a long time. Incidentally, Isha was a Hispanic too. So we had to give them a form to fill out. So I know what is the name of the patient, what is the age of the patient, what is their phone number, what is their address, and have they been to my pharmacy or not, or if they are taking any medication. So the younger girl got upset. She said, check the blood pressure now because my mom is not feeling good. So it was a tricky situation, you know. Anyway, so I gave the things to Isha and I said, make sure that we get filled this thing up and then check it out. So I went out with my blood pressure unit and I measured the blood pressure. It was 237/92. That's pretty high, you know. Normally, if this kind of situation occurs, you call an ambulance, or we call it here paramedics, and you transport the patient to the hospital. I was not going to do that. Yeah, that's for sure, you know, because I thought that there is something I need to know more. So once that paper got ready, Isha looked at me and she smiled. So I understood that there is something which I know, which I want, that she has found it. That patient was our patient. She has been coming to Walgreens Pharmacy for last 3 years. And then there was a medication on that profile. One was the blood pressure medication. The name of the medication was metoprolol tartrate, 50 milligram, 1 POBID. That means they take 1 tablet twice a day. She had taken some birth control pill. She had a UTI infection, so she had taken some Cipro. She had taken some, had some yeast infections. So they were minor things, you know. Well, I know where I was going. So I called them, I asked Isha to call the store manager and tell that person that they should keep an eye because we have got a difficult case. And I still wanted to know more. So I said, Isha, go and communicate with this lady and find out what actually happened and then tell me. But before you do that, be friendly with her, buy her some coconut water. And I gave her my credit card. I said, go and buy a large coconut water with pineapple juice in it and let her drink. Can we change this slide, please? Okay. Now, the reason I gave coconut water, because I wanted her to void her bladder. So if there is a volume problem and that's why the blood pressure is coming high, I wanted to make sure that she is relaxed. And I wanted somebody to talk to her in her own language and find out. Yeah, my assumptions were right. They had a lot of relatives there. The argument came there and she got a little bit agitated. So she left the house with her younger daughter and says, let's go to the pharmacy and they will measure my blood pressure. Isha did a wonderful job. She not only found out that, but she also found that this lady has not taken last 3 doses of metoprolol tartrate. That's very good. So I had my answer. You know, you guys should know your beta blockers and things like that, okay? So when I came out second time, I said, can you do me a favor? I said, can you breathe in through your right nostril and breathe out through left nostril for 10 times. And I said, if you do 5, I will be happy. So she did that. And I said, yeah, please go to the restroom and come back. She went to the restroom and she came back. While she came back, she was smiling. There was no hot flashes on her cheeks. And I measured the blood pressure again. It was 157/82. Okay. So I said, you are doing very good. But, you know, Isha tells me that you have missed some medication. So I'm going to give you some medication and you take it here now. You'll be okay. And I will let your doctor know. So make sure you visit the doctor, you know, as soon as the long weekend is over. I want you guys to follow that how I am collecting the data, what I am doing, and what I am telling the customer. Okay. Now, I have to communicate with the doctor. Now, as a pharmacist, I know that this patient is non-adherence. She has got a busy house. She cannot even take medication twice a day, and there is a product available, which is only once a day, which is extended release, and she will be okay. Somebody would have said that your doctor gave you the wrong medication. No, you never do that. You do not want to have a rift between a prescriber and the patient. That's the cardinal sin. You know, remember I said, if you want to live in water, do not make the crocodile your enemy. So I went to the computer and I wrote an email to prescriber. And then I said very nicely, and I wrote that what time she came in, what form she filled out, and what it is, and what did I do. The first time, what was the blood pressure? Second time, what was the blood pressure? I gave her the coconut water, and you know, we talked to her, we tried to comfort her. And then I said, doctor, this is the opportunity for you to change the medication to metoprolol succinate 100 milligram ER once a day. And your patient will be very happy and she can have a very fruitful advantage of maintaining her blood pressure. Can we change this slide, please? Now, see, if you have got a pharmacy clinic, Uttar Pradesh, they open five pharmacy already, you know, where they are doing a pilot study through the health department of, of India. Dr. Mansukh Bhai Mandavia is doing that. Imagine one thing. There is a lady just got married. She's going to go on a vacation. She walks in the pharmacy. Not she doesn't walk in the pharmacy. It is time for her to buy her birth control pill. So she tells her husband that when you come home, you go to the pharmacy and pick up the medication. And they were going to go on a vacation. Now, this lady had also gone to a dentist because she had some dental pain. And she told the dentist that I'm going to go on a vacation. So he said, okay, fine, take the antibiotics for 10 days. And when you come back, we will do the root canal. So this lady was in a hurry. So she came to the pharmacy. She said that this is the prescription doctor gave me, very educated girl, and she wanted to do everything by the books, So, and he says, my husband will pick up the medication in the evening, let me go because I have to reach home because tomorrow we are going out. So pharmacy says, that's okay, fine, we'll do that. The husband comes in the evening, he picks up the birth control pill and the antibiotic. This is a prescription for a pregnancy. They were going to go on a vacation. They were recently married. I don't think that she had planned a baby at this time. And just because somebody forgot to tell them that taking antibiotics along with the birth control pill reduces the effectiveness of the birth control pill at least by 15 to 20%. Now, how are you going to counsel these patients? The husband is not there, somebody should tell them you use the alternate contraceptive measures, if they want to do this thing, the husband should use the condom, but somebody has to tell them, but nobody told them. So what? They go on a vacation, they come back and she is pregnant, she doesn't want to get pregnant. So what? They are going to name the baby as a Hindu pharmacy baby or a Jai, whatever is the name of the Jai Krishna medical store, So this is where you come into help. Now, suppose you go into people's house and you find this thing out and collect the data, come back to your professor. They know these things. You study it and then you do that. Another example is that, what is the most overprescribed medication in the world? Is anybody from pharmacology there? No? PharmD students? Anybody from pharmacognosy? Nope. Okay, very good. Do you know what simvastatin is? Somebody has to say something. Hello?
Sir, it's an HMG-CoA reductase inhibitors.
Simvastatin is what is it? What is simvastatin?
Hyperlipidemic.
Sir, hyperlipidemia, anti-hyperlipidemia.
Thank you so much. Thank you. So say in a layman's term, it's a cholesterol medication, right? Cholesterol lowering medication, right?
Yes, sir.
Anybody who takes this medication for more than 3 to 6 months, they all
No,
get
sir.
leg cramps. They all will get leg cramps. It's a universal fact.
Okay.
Now, why do they get leg cramps? Go to second B from biochemistry. How does the body get the energy? Something called ATP? How does ATP form from ADP? There is a 4-minute time. Simvastatin blocks the production of conversion into ATP, so the energy is being deprived. So the muscles become weak. There is a product called nutraceutical called coenzyme Q10. in America, especially I belong to Kaiser Foundation. Kaiser is the largest insurance, what do you call it here? Yeah, insurance carrier in California on the West Coast, and Geisinger is the largest in the East Coast. Every time a cardiologist write a prescription, they put nutraceuticals coenzyme Q10 on the prescription. People go to Costco drugstore and they buy it there because they have got the cheapest price. I'm going to slightly deviate. You know that Dr. Ananta was doing that experiment, that case study, and there was a amlodipine written there. What is amlodipine?
Channel blocker, sir.
It is a
Calcium
channel.
channel blocker.
It's an antihypertensive.
That's good. When I say, you know, what kind, then you tell me it is a channel blocker. Now, there are three channels, right? Calcium channel blocker,
Yes,
channel
sir.
P, channel L, channel N, right?
Yes,
So
sir.
it is going to relax the muscles of the heart to lower the BP, right? Just like beta blockers, okay? Now, if that is going to do with the heart muscle, it is going to do to the other muscles too. You know, that lady had a GERD because the sphincter valve was not functioning well because she was taking amlodipine. And anybody who takes amlodipine more than 10 milligrams or 10 milligrams a day, within a short time, they will be on a proton pump inhibitors because they will have a gastric problem. And then if you do not change the medication, they will be taking the Prelosec or Acifex along with that. And if it is a woman, they will start losing hair very slowly. And women can only find whenever they go and wash their hand. Man can, you know, doesn't care about their hair, you know. So sometime telling a patient how to take medication, that helps, you know. I will give you one more example about the time. You know that, let's take that metoprolol tartarate. Can anybody tell me what are the side effects of metoprolol tartarate? Very quickly.
Which one? Sorry,
What
sir.
is the side effect of metoprolol tartarate?
Sir, kidney,
Beg your pardon?
kidney problem, sir.
Well, you are going on the organ, but what is the most common side effect? Okay. Metoprolol tartarate has got a side effects of lethargy and feeling a little bit tired. Now, if the doctor told a lady to take the medication, and suppose that lady is your mother, she's around 45 years old. She has to take one tablet at 8 o'clock and one tablet at 4 o'clock. Because I was in India and I went to a dentist and, you know, they gave me one prescription. So that's the way they write prescriptions, you know. And I said, that's very good. You are telling me what time to take, you know, that's great. Now, if a woman has a blood pressure, she takes medication at 8 o'clock in the morning, and considering the Indian way of living, for anybody's, not Indian way of living, in anybody's house, if woman is not working, she has to get the kids ready to go to school. She has to make the breakfast. She has to make the tiffin for her husband. She takes that medication at 8 o'clock and she is already showing the sign of lethargy. You know, then again, she takes the same medication in the evening at 4 o'clock. By the time the kids come home, they are going to feel that mom is really tired. In your opinion, what will be the best time to take it? When everybody is out of the house, right? The kids have gone, husbands have gone. She has put away her morning breakfast thing. She can have a nice cup of coffee, and she can take her metaphorical daughter at 10 o'clock. What difference does it make you take at 8 and you take at 10? In the evening, why do you want to take it at 4 o'clock? Take one when you go to sleep. So you can get asleep a lot quicker, right? There are a lot of medications like that where you can select the time of the medication to be given according to the lifestyle of that particular family. Now simvastatin has got some other problems in males too, and it's like a, what do you call it? It's related to ED, what is the most forgotten element in the world? Everybody talks about calcium. Nobody talks about magnesium. Nobody. Oh, I take my calcium tablet. Oh, for the osteoporosis, I take for this thing, for for building the bone up. We go and give calcium to our children. So they have got a very happy growing up. Magnesium helps to increase the contractibility of the ventricular muscle of the heart. So there is a better rhythm. If it can help the heart, why can't it help the leg cramps? Why can't it helps the your hand? So the nutraceuticals are very, very important. Nutraceuticals is a $640 billion industry in this country. That lady, I forgot her name. I'm sorry, ma'am. Vishnu, or reading my profile, that I worked in the industry for 18 years. Yeah. I used to make a lot of nutraceuticals. The coenzyme Q10, the father of coenzyme Q10 in America, his name is Dr. Raj Chopra. He is a graduate of 1965 LM College of Pharmacy, Ahmedabad. Right after his B Pharm, he was selected to go to Oxford. And then from Oxford, Columbia University called him for higher education directly. He has got a company by the name Tishcon. He's around 88 years old now. 80 or I think 85 years old now. He and I work in the same company. He was a technical director of a company called Private Formulation in the back east. And I had just come to America. It was two years after that. I was the technical director of a company called Winning Laboratories, and Paul Anger was he was the Israeli guy, Jewish guy, was our boss. And these are the things he taught me, Raj Chopra. I am so much thankful to him. I learned a lot of formulations with him, So when I say that, do you love pharmacy? That's what I mean. Whatever you do, whatever you study, it is going to be helpful somewhere. India is the largest exporter of moringa leaves, which is used very widely in this country for arthritis. Every time you get antibiotics, people should take probiotics, eat some yogurt. You have to think about, because of the pandemic, steroids are very, very widely used. what happens when you take steroids? Can somebody tell me? What happens to your body metabolism? You can say anything, I'm not going to judge anybody. What part of the body it affects? Whenever you take steroids, the blood sugar goes up. That's the first effect. You know what they are predicting right now? 50% of the population is going to be diabetic in India. In America, we already have 33%, because some of the steroids needs to be taken all the time. So the pharmacists are needed. How can you off balance it?
Can I add a small note here regarding the corticosteroids and the hyperglycemia?
Yeah, that's what it is.
I have come across a autoimmune disorder like Takayasu arteritis, wherein the patient has been consuming prednisolone for around 15 years of from 5.
No, that patient is going to get osteoarthritis and osteoporosis. Prednisolone will eat up the
Diabetic
bone.
profile. Hello.
Yeah, diabetic.
So
You're right.
So we came to know that at a lower doses of steroid administration, there was a lower onset of GRBS. I mean to say that not hypoglycemia, but there was not hyperglycemia at certain dose of steroids.
No, even if you take 5 milligram of prednisone, you will get a hyperglycemia. Okay,
yes, sir. Yes, sir.
Okay.
I got it. I understood what you're trying to say. But in that
Now,
specific patient, we monitored this effect. I just wanted to add to your point here. That's all.
no, I understand, but that's what I'm going to say you. See, you have to find out what disease they have got. If it is an autoimmune disease and she is supposed to take it for all the time, I think somebody's mic is on.
Sir, actually, sorry for inconvenience. We had to be wind up another 5 or 7 minutes only, sir, because we have taken permission to over.
Okay, yes, I'll finish it. I'm almost done. There's 1 or 2 slides left. Okay.
Okay, sir.
Let me answer her on the prednisolone. Now, Dr. Ananta mentioned about millet. Okay. There is a person in India, and I think you should know in Bangalore. In Bangalore, there are a lot of restaurants which are only, they sell millets. There is a guy by the name Dr. Khadarwali, who is known as a millet man of India. He got a Padma Shri award.
Yes, sir.
Okay. It is known as a Sridhanya millets. Look it up.
Yes,
and ask that patient to start taking Sridhanya millets. I have been eating Sridhanya millets last almost 2 years. Today I had a barnyard millet. Okay. With some yogurt. My diabetes was 9.5 A1C. Okay. It has come down to 6.9. The nutrition can do wonders. Whenever you are measuring something, and the steroids, you have to get it eliminated from the body. Now, if you are going to eat this millet, why does it help? Because the carbohydrate to fiber ratio. See, the Sridhanya millets have got 5 millets which are nutraceuticals. Their carbohydrate to fiber ratio is less than 10. And that puts more fiber into your stomach So the uptake of glucose, of carbohydrate into the blood goes over a period of time. You are going to create a time release product in your stomach. So look that thing up, and if anybody has got more questions, ask me, because I have studied that quite a bit, okay? Now, I'm almost done here. Thank you so much. And the sky is the limit, what you want to do. I am going to skip this slide number 12, because those all were my friends. We did a seminar at Ahmedabad for the Diamond Jubilee, so I was going to thank them for that. But you guys have got my, no, you can go to the last slide, okay? These all are my classmates, we all came to India. These all people, we all came to India for the Diamond Jubilee celebration, and we all have retired now, Bhalani he owns the Connect Pharmaceutical company. Mahesh Shah, he was a drug controller in the state of New Jersey. Abu Wala was a community pharmacist, and Basant Sharma retired as a global head of the oncology pharmacy of Johnson & Johnson. We all studied together. Thank you. And let's go to the last slide. And you should love what you are doing. And if you have got any questions, my number is there. Ask me. Of course, there is a timing change, and I will reply you. But everybody should eat millet. That's what Dr. Ananta was saying, today is the millet day, and Dr. Khadivali is an amazing guy, Thank you so much. I'm all done.
Thank you so much, sir, for that amazing session, actually. And we feel really lucky to hear from such an experienced person. And we know that it's a little unfair to ask, but still, we would like to ask you, like, if you can join with us one day, so that our students have an interactive session with you. And thank you.
Anytime, okay. And go and make a lot of money. Each one of you share 100 customers, patient, charge them 500 rupees a month and make money.
And now I request Dr.
I took too long today, I'm sorry about that, okay. It just went on.
Very good afternoon all. On behalf of the management, it's okay, sir. It's okay. On behalf of the management, Dhanasakar University, I take the privilege of proposing a vote of thanks. We are all happy that the Community Connect Pharmaceutical Field Services webinar has been organized and conducted extremely well. First of all, my sincere thanks to our speakers accepting that Dr. Anantanaik Nagappa sir and Mahadev Bhatt speaker for accepting our invitation and being with us this morning. Thank you for that interesting and highly informative speech. I would like to thank Dr. Pushpa Sarkar on this wonderful occasion. Your thoughts have enlightened our minds. Thank you so much. I am immensely thankful to our beloved principal, Dr. N.M. Raghavendra, for his efforts towards the event today. His own ideas and elegance of explanation for everything. I need to mention my deepest sense of appreciation. Thank you, sir. You have been fortunate enough to be backed by a team who are very proactive and dedicated staff of our institution, who are well versed in their job. I thank all the coordinators for organizing this wonderful event.
Thank you. Namaskaram.
Yes, I would like to thank media for covering the event, especially the Imtiaz. I would like to thank for all non-teaching staff that help making necessary arrangement for this program. Finally, I thank the student volunteers and Saptaranga team for their constant support for these programs. Last but not the least, I thank all the students for their active participation. Thank you, one and all. Thank you.
Thank you. I will sign off.
Thank you, sir. Thank you, sir.
Be nice to your students, okay? Give them good marks.
Yes, sir. Yes, yeah, okay, okay. Done, sir. We already
Yeah.
given, sir, and giving also.
Okay, thank you much. And any questions, please send me a note, okay?
Sir, can we have one photo? Everyone, please mute your video and not please. Anju, can you take photo? Snap, sir. Yes. Lita, Anju, photo. Open. Unmute your video, please.
Yeah, yeah. Yes, ma'am, it's done.
Yes, Archana. Yes, thank you. Thank you, sir. Thank you all.
Thank you. Make some money, okay? Charge them. You deserve the money.
Okay,
Okay.
sir.
500
Sure, sir.
rupees a family, okay?
Okay,
Thank
then, sir, then we will share to you also, sir, for you and Nagapa, sir, also, sir, after we event.
It is an honor to be with Dr. Nagappa, you know. 5 or 10 years from now, you guys will know that the movement he has
Yes,
started, you know. See, you should love what you're doing. Thank you so much. Bye now.
yes, yeah,
Thank
that's
you
true,
so
sir.
much, sir. Have a nice day.
Yeah, have a nice weekend, sir, and
Thank
everyone,
you so much.
nice weekend. Thank you, sir.
Okay.
Mahadev sir to be told good night maybe.
You know, this thing,
Oh,
because of cataract surgery, I had to take my glass off. I have got a glass only in one eye. The
oh,
next surgery is on 23rd in the right eye.
sorry for the
Sorry,
inconvenience.
sir.
No, there's no, it's not. It's fun. I love my pharmacy. I love it, man. Anytime you want, I will come, okay? And we will discuss any case
Okay,
studies.
sir.
Thanks to Dr. Nagappa.
Thank you, sir.
Blessed to
Thank
talk
you,
to
sir.
you, sir. So you're on mute, sir.
Goodbye and see you soon.
Yes,
Thank
sir.
you.
Right.
Thank
Thank
you
you,
for
sir.
the
Have a
opportunity.
nice weekend, sir.
Oh, sure.
Thank you, sir.
Okay.
Thank you, sir.
Thank you, sir.
Finally, it's over now.